Thank you, Mr. Williams, and good afternoon to everyone. I want to join you, Mr. Williams, in wishing our nurses a happy International Nurses Day. Our nurses are our frontline warriors in our response to COVID-19, and today we pause to celebrate our nurses for the tremendous service that they are extending to our people. Today, May 12th, it's my task, as per usual, to share with you the Health Emergency Operating Center Situation Report. To date, the Federation of St. Kitts and Nevis have reported a total of 45 confirmed cases of COVID-19. 44 of these cases have fully recovered, and so at present we are only monitoring one active case who remains stable. Between last January to present, over 159.2 million persons impacted by this disease, and over 3.3 million persons have died. Concurrently, countries around the world have rolled out their COVID-19 vaccine programs, and to date, over 1.2 billion COVID-19 vaccine doses have been administered. 32.7 million confirmed cases reside in the United States of America, and over 582,000 persons have died from this disease, as reported by the USA thus far. Now, this slide just provides you a snapshot as to what's happening in some territories with respect to the vaccine rollout. Now, in Israel, they would have vaccinated or fully vaccinated about 56% of their population, the USA 35%, the United Kingdom 27%, Canada 3.4%. And this refers to fully vaccinated. The number of cases in the Caribbean region continue to increase, and amongst the CARICOM member states, collectively they would have reported over 167,000 cases so far, and almost 3,000 deaths as a result of COVID-19. In terms of the Organization of Eastern Caribbean States, the OECS territories, a total of 12,311 cases have been reported by the OECS territories collectively, and also about 166 deaths have occurred as a result. Now, like St. Kitts, the Caribbean islands, the OECS territories, they are also administering the COVID-19 vaccines to their people. So in Anguilla, they would have covered 42% of their population. In Antigua and Barbuda, approximately 32%. Barbados, about 26% of the population. Similarly, Dominica, 26%. Grenada, 12%, Montserrat, 22%, St. Lucia, 14%, St. Vincent and the Grenadines, 13%. And these, the coverage I just shared speaks to the coverage as it pertains to the first dose, the administration of the first dose of the vaccine. In St. Kitts and Nevis, as at yesterday, Tuesday, May 11th, a total of 14,968 vaccine doses have been administered in the Federation, with 11,466 in St. Kitts, 3,502 Nevis. Now, this represents 41.6%. So, in other words, almost 42% of the target population have been covered with the first dose of the AstraZeneca Oxford vaccine. In terms of the number of persons who are fully vaccinated, As at yesterday, that stands at 1,237, or almost 4% of the target population covered with 2 doses of the AstraZeneca Oxford vaccine. Ladies and gentlemen, we continue testing and we continue our surveillance, public health surveillance. And so everyone who presents at the emergency room at the JNF Hospital, Alexandra Hospital, with COVID-like symptoms, they are tested. So to date, we've tested over 13,900 persons with a positivity rate of about just 0.3%. This just highlights the fact that 44 of our cases have recovered. We only have 1 in isolation, and at present approximately are over 700 persons in quarantine. This figure includes the last batch of students, the RUSVM students who would have returned 1 week ago. So they have completed their first week in quarantine. They have a second week to go, before which they would be tested. Once their results return negative, then they would be free to integrate into our society. Ladies and gentlemen, the Ministry of Health and the government, by extension, we have 2 broad strategies when it comes to the COVID-19 response. And one, we aim to minimize the risk of exposure to the SARS-CoV-2 virus. And so all we are doing, our health and travel protocols, our surveillance efforts, all in an attempt to minimize the risk of exposure of the virus. And so with respect to what Superintendent Henry just shared, again, we need to monitor our borders. Border surveillance, very, very important, because we again need to minimize the risk of entry of the virus into the Federation. And our aim is also to reach the herd immunity. And so we are aiming to vaccinate the adults in our population, and the adults comprise 70% of our population. And so we would like to get there at the soonest. Now, to date, a number of COVID-19 vaccines have achieved World Health Organization emergency use listing. And so there are 5 such vaccines. These are the front runners. 1, you have the Pfizer-BioNTech, and then you have the AstraZeneca Oxford vaccine, which is the one that we are administering to our locals. You have the Johnson-Silags Johnson & Johnson vaccine. You have Moderna. And then just this week, it was announced that Sinopharm, China's Sinopharm COVID-19 vaccine, has achieved the WHO green light. So WHO listed Sinopharm vaccine for emergency use. So this occurred just this week. Now, as we all know, the Oxford AstraZeneca vaccine is a vaccine that's available locally. And those of us who would have accepted this vaccine, once you get your second dose and then 2 weeks would have passed, you would be deemed fully vaccinated. Once you're fully vaccinated, you would enjoy a significant risk reduction in your ability to contract this disease. So this vaccine has a 2-dose regimen, whereby we give you the first dose and you're given an appointment to come back for the second dose. Now, this appointment can be anywhere between 4 to 12 weeks, but most persons so far have been given a 10-week appointment. The WHO recommends that the 2 doses, the interval, should be anywhere between 8 to 12 weeks. We are administering this vaccine to adults only, meaning persons over the age of 18. Ladies and gentlemen, please note that the present batch of vaccines that we have, they have a limited shelf life. What does that really mean? They're going to expire very soon. So by the end of June, the present batch of vaccines will expire. And I pause to underscore this because there are a number of individuals, when you ask and inquire, have you, accepted the vaccine as yet? You are told, I'm waiting. Please note that the present batch of vaccines, they have a limited shelf life. In other words, they will expire by the end of June. And so just a few hours ago, I got my second dose of the Oxford AstraZeneca vaccine. So I was given the appointment for today, May 12th. And so I kept my appointment. I was very particular in keeping my appointment. So I went and I got my second dose. So far, so good, no problems. I want to remind the persons who would have gotten their first dose, I want you to look at your card this evening and note the date and try your very best to keep your appointment and return for your second dose. And please remember to take your card with you when you go for your second dose. Right? So walk with your vaccination record card, because once you receive your second dose, it will be officially stamped and signed. And so that would be your official COVID-19 vaccination record card. Now, we just got, WHO just published and disseminated an interim document about the AstraZeneca Oxford vaccine. And we note that the vaccines are equivalent and interchangeable for both doses. And so the Oxford AstraZeneca vaccine is manufactured in by three different manufacturing companies. And so you have the Serum Institute of India manufacturing this vaccine, and you have South Korea manufacturing this vaccine. And so what they're saying is that the vaccines are the same and they are interchangeable. So if your first dose was Serum Institute, you can get your second dose, same vaccine, Oxford AstraZeneca, but it can be manufactured by South Korea. Please also note that this vaccine, the AstraZeneca Oxford vaccine, can be offered to breastfeeding or lactating women. So the Ministry of Health here in the Federation, we are offering the AstraZeneca Oxford vaccine to women who are breastfeeding or lactating. Please note, it's not a live virus vaccine, and by extension, it is biologically and clinically unlikely to pose a risk to the breastfeeding child. However, we are not offering this vaccine to pregnant women at this time. This vaccine is safe. The Oxford AstraZeneca vaccine is safe. It can be administered to persons who are living with HIV. So in other words, persons who are living with HIV may be vaccinated utilizing this vaccine. This vaccine is safe. It can be given to persons who are immunocompromised. So for example, persons with severe diabetes, persons who are taking steroids for other reasons, other medical reasons, they can take this vaccine. Persons with autoimmune conditions may be vaccinated. Persons who've had COVID-19 can also be vaccinated. The science or the literature says that you can allow a month or two to elapse between your recovery from the natural disease, COVID-19, before you can proceed and accept the vaccine. What are some of the benefits of this vaccine? As I've said repeatedly, it is safe and effective. It works well in older people. In other words, it has a fairly good or an acceptable efficacy in older adults. It provides some protection against emerging variants. And when I say that, I mean all the emerging variants of public health concern. So there's a new one on the block right now. So you have the variant identified in the United Kingdom, the variant identified South Africa, Brazil, and now you hear about the variant identified in India. And so what the literature is suggesting is that the Oxford AstraZeneca vaccine provides some protection against these emerging SARS-CoV-2 variants. And it's interesting to note that this vaccine has a very wide global reach, with over 148 countries worldwide utilizing this vaccine as compared to the others. These are some of the common symptoms that our people have been complaining of, or they express, or they describe after receiving the vaccine. Just pain at the injection site. I felt a little pain this afternoon, yes. Some persons complain of a fever, which is relieved by paracetamol or acetaminophen, or just feeling lethargic or complaining of fatigue. But between last week and now, persons who have received the second dose, I have not heard much complaints from individuals who have received the second dose of this vaccine. On April the 27th, the Honorable Prime Minister, Dr. Timothy Harris, he would have announced some policy changes with respect to the reduction in the quarantine period for inbound air travelers who are fully vaccinated. So persons who are traveling to the Federation and those who are fully vaccinated, when I say fully vaccinated, what do I mean? A person or an individual is deemed fully vaccinated if 2 weeks would have passed after having the second dose of a 2-dose vaccine, or 2 weeks after receiving the 1 dose of the Johnson-Silags Johnson & Johnson vaccine. So if you are an inbound traveler who is deemed fully vaccinated, and if you've been vaccinated with any of these, that's the Pfizer, BioNTech, Moderna, AstraZeneca, Johnson & Johnson, you would probably qualify for a reduced quarantine period of 9 days. However, please note, you still have to complete the entry form on our website. You still have to submit a negative RT-PCR test done within 3 days of travel. And once you meet all the requirements, you would qualify for a reduced quarantine period of 9 days. You will be tested on day 9, and once your result returns negative, you would be officially released from quarantine on day 9. Effective May 20, fully vaccinated spectators or patrons would be able to gain access to sporting events like football, athletic meets, cricket, etc. And so I am encouraging the football lovers, as seen in the picture. It's easier. Just go get your vaccine and you can go inside the park and look at the match. Effective, well, let me just add, yes, if you are fully vaccinated, you can gain access to a sporting event. However, you need to wear your face mask. You must maintain hand hygiene. There will be temperature checks. They're going to ask you your name, and you're going to have to provide some contact information upon entry. And we implore the sporting event organizers that you need to seek approval from the Ministry of Sports along with the Commissioner of Police. Effective July 19th, fully vaccinated cultural events can be favorably considered, whereby fully vaccinated patrons can be allowed entrance to such events. However, again, vaccinated patrons, you would have to maintain hand hygiene, temperature checks on entry. You must wear your face mask, provide your name and contact information, and then there would be reduced patron capacity. Now, we also recommend that all event operators, event staff, and entertainers must be fully vaccinated. Please note, the organizers of these events must first seek approval from the Commissioner of Police. This just highlights that there is a travel advisory for travelers coming in from Brazil, UK, South Africa, India. However, citizens and legal residents returning from these territories, you will not be denied entry. However, you would have to complete the form and you will be expected to quarantine for 14 days. Ladies and gentlemen, let's protect ourselves. Let's vaccinate. # do not wait, vaccinate. Thank you.